Next generation NCLEX practice questions, prioritizing client care, leadership, delegation, and emergency response planning. Question 1. The nurse is assigned to care for clients. In planning client rounds, which client would the nurse assess first? 1. A post-operative client preparing for discharge with a new medication. 2. A client requiring daily dressing changes of a recent surgical incision. 3. A client scheduled for a chest x-ray after insertion of a nasogastric tube. For a client with asthma who requested a breathing treatment during the previous shift. What is the answer? Answer 4. Rationale. Airway is always the highest priority, and the nurse would attend to the client with asthma who requested a breathing treatment during the previous shift. This could indicate that the client was experiencing difficulty breathing. Question 2. The nurse employed in an emergency department is assigned to triage clients coming to the emergency department for treatment on the evening shift. The nurse would assign priority to which client? 1. A client complaining of muscle aches, a headache, and history of seizures. 2. A client who twisted their ankle when rollerblading and is requesting medication for pain. 3. A client with a minor laceration on the index finger sustained while cutting an eggplant. 4. A client with chest pain who states that they just ate pizza that was made with a very spicy sauce. What is the answer? Answer 4. Rationale. Clients with trauma, chest pain, severe respiratory distress, limb amputation, or acute neurological deficits, chemical splashes to the eyes are the highest priority. Clients with conditions, such as a simple fracture, asthma without respiratory distress, fever, hypertension, abdominal pain, or renal stone are classified as a second priority. Clients with conditions, such as a minor laceration, sprain, or cold symptoms are a third priority. Question 3. A nursing graduate is attending an agency orientation regarding the nursing model of practice implemented in the healthcare facility. The nurse is told that the nursing model is a team nursing approach. The nurse determines that which scenario is characteristic of the team-based model of nursing practice. 1. Each staff member is assigned a specific task for a group of clients. 2. A staff member is assigned to determine the client's needs at home and begin discharge planning. 3. A single registered nurse RN is responsible for providing care to a group of 6 clients with the aid of an assistive personnel AP. 4. An RN leads to licensed practical nurses LPNS and 3 APS in providing care to a group of 12 clients. What is the answer? Answer 4. Rationale. In team nursing, nursing personnel are led by a registered nurse leader in providing care to a group of clients. Option 1 identifies functional nursing. Option 2 identifies a component of case management. Option 3 identifies primary nursing relationship-based practice. Question 4. The nurse has received the assignment for the day shift. After making initial rounds and checking all of the assigned clients, which client would the nurse plan to care for first? 1. A client who is ambulatory, demonstrating steady gait. 2. A post-operative client who has just received an opioid pain medication. 3. A client scheduled for physical therapy for the first crutch walking session. 4. A client with a white blood cell count of 14,000 mm for 10 L and a temperature of 38.4 C. What is the answer? Answer 4. Rationale. The nurse would plan to care for the client who has an elevated white blood cell count and a fever first, because this client's needs are the priority. The client who is ambulatory with steady gait and the client scheduled for physical therapy for a crutch walking session do not have priority needs. Waiting for pain medication to take effect before providing care to the postoperative client is best. Question 5. The nurse is giving a bed bath to an assigned client when an assistive personnel AP enters the client's room and tells the nurse that another assigned client is in pain and needs pain medication. Which is the most appropriate nursing action? 1. Finish the bed bath and then administer the pain medication to the other client. 2. Ask the AP to find out when the last pain medication was given to the client. 3. Ask the AP to tell the client in pain that medication will be administered as soon as the bed bath is complete. 4. Cover the client, raise the side rails, tell the client that you will return shortly, and administer the pain medication to the other client. What is the answer? Answer 4. Rationale. The nurse is responsible for the care provided to assigned clients. The appropriate action in this situation is to provide safety to the client who is receiving the bed bath and prepare to administer the pain medication. Options 1 and 3 delay the administration or medication to the client in pain. Option 2 is not a responsibility of the AP. Question 6. The nurse manager has implemented a change in the method of the nursing delivery system from functional to team nursing. An assistive personnel AP is resistant to the change and is not taking an active part in facilitating the process of change, which is the best approach in dealing with the AP. 1. Ignore the resistance. 2. Exert coercion on the AP. 3. Provide a positive reward system for the AP. 4. Confront the AP to encourage verbalization of feelings regarding the change. What is the answer? Answer 4. Rationale. Confrontation is an important strategy to meet resistance head-on. Face-to-face meetings to confront the issue at hand will allow verbalization of feelings, identification of problems and issues, and development of strategies to solve the problem. Option 1 will not address the problem. Option 2 may produce additional resistance. Option 3 may provide a temporary solution to the resistance but will not address the concern specifically. Question 7. The registered nurse is planning the client assignments for the day. Which is the most appropriate assignment for an assistive personnel AP? 1. A client requiring a colostomy irrigation. 2. A client receiving continuous tube feedings. 3. A client who requires urine specimen collections. 4. A client with difficulty swallowing food and fluids. What is the answer? Answer 3. Rationale. The nurse must determine the most appropriate assignment based on the skills of the staff member and the needs of the client. In this case, the most appropriate assignment for the AP would be to care for the client who requires urine specimen collections. The AP is skilled in this procedure. Colostomy irrigation and tube feedings are not performed by APs because these are invasive procedures. The client with difficulty swallowing food and fluids is at risk for aspiration. Question 8. The nurse manager is discussing with the staff the facility's protocol in the event of a tornado. Which instructions would the nurse manager include in the discussion? Select all that apply. 1. Open doors to client rooms. 2. Move beds away from windows. 3. Close window shades and curtains. 4. Place blankets over clients who are confined to bed. 5. Relocate ambulatory clients from the hallways back into their rooms. What is the answer? Answer 2, 3, 4. Rationale. In this weather event, the appropriate nursing actions focus on protecting clients from flying debris or glass. The nurse would close doors to each client's room and move beds away from windows, and close window shades and curtains to protect clients, visitors, and staff from shattering glass and flying debris. Blankets need to be placed over clients confined to bed. Ambulatory clients need to be moved to the hallways from their rooms, away from windows. Question 9. The nurse employed in a long-term care facility is planning assignments for the clients on a nursing unit. The nurse needs to assign for clients and has a licensed practical nurse and 3 assistive personnel APS on a nursing team. Which client would the nurse most appropriately assign to the licensed practical nurse? 1. A client who requires a bed bath. 2. An older client requiring frequent ambulation. 3. A client who requires hourly measurement of vital signs. 4. A client requiring abdominal wound irrigations and dressing changes every 3 hours. What is the answer? Answer 4. Rationale. When delegating nursing assignments, the nurse needs to consider the skills and educational level of the nursing staff. Giving a bed bath, assisting with frequent ambulation, and taking vital signs can be assigned most appropriately to an AP. The licensed practical nurse is skilled in wound irrigations and dressing changes and most appropriately would be assigned to the client who needs this care. Question 10. The charge nurse is planning the assignment for the day. Which factors would the nurse remain mindful of when delegating tasks? Select all that apply. 1. The acuity level of the clients. 2. Specific requests from the staff. 3. The clustering of the rooms on the unit. 4. The number of anticipated client discharges. 5. Client needs and workers' needs and abilities. What is the answer? Answer 1. 5. Rationale. There are guidelines that the nurse would use when delegating tasks which include: ensure client safety, be aware of individual variations in work abilities, determine which tasks can be delegated and to whom, provide directions that are clear, concise, accurate, and complete. Staff requests, convenience, and anticipated changes in unit census are not specific guidelines to use when delegating tasks, but may be considered when making assignments. How many correct answers did you get? Thank you for watching. Like, comment, share, subscribe for more.